Welcome to MediByte. I'm your host, and today we're diving into a really frustrating medical mystery in this explainer. We're looking at a hidden cause of chronic pelvic pain that so many people deal with, but almost nobody talks about. You know, if you've ever felt like your pain is totally invisible, today we're putting it front and center. Let's get right into it.
First off, if you've been living with unexplained long-term pelvic discomfort, I really want to start by saying your pain is completely valid. It's real. Far too often, this kind of persistent ache just gets brushed off, or worse, misdiagnosed, which leaves you endlessly searching for answers. As a healthcare professional, my goal here at MediByte is to give you some actual clarity. So today, we're getting right to the bottom of it and breaking down exactly what might be happening inside your body.
Okay, here's our roadmap for today's explainer. We're going to cover the mystery of pelvic pain, understand pelvic venous disorders, recognize the symptoms, figure out how doctors diagnose the problem, and then finally, we'll look at effective treatments.
Section 1. The mystery of pelvic pain. The timeline of discomfort.
So, 6 months. This is basically the magic number in the medical world. When pelvic pain lasts longer than 6 months, it officially crosses the line. It goes from being just a temporary ache into a chronic medical issue, right? It's no longer just some passing cramp, it's a persistent condition, and it absolutely requires your doctor to dig deeper. So if you've been tracking your pain and you've passed that 6-month mark, that is a really crucial piece of data you need to share with your healthcare provider.
Moving on to Section 2, Pelvic Venous Disorders, Understanding the Cause.
All right, pelvic venous disorders, which, by the way, you might sometimes hear called pelvic congestion syndrome, is defined by chronic pain in the lowest part of the abdomen, your pelvis. But the key thing here is why it happens. It happens because blood is literally accumulating and pooling in the veins of the pelvis. These veins have become super widened or dilated and really convoluted. It's a bit of a traffic jam, honestly. And hey, having this exact medical term, that gives you something super concrete to take directly to your doctor.
To really picture what's going on, just think of varicose veins. You've probably seen them on people's legs, right? Those bulging, twisted, bluish veins. Well, pelvic venous disorders are essentially the exact same thing. The catch is they're hidden completely out of sight, tucked way deep inside the pelvis. And because you obviously can't see them on the surface of your skin, the pain they cause can feel like it's coming out of absolutely nowhere.
Now, who does this usually affect? Well, it's most common in reproductive age women. Medically speaking, there's a really strong hormonal link here. We actually know that estrogen may contribute to the development of these widened veins. That's exactly why it mostly affects premenopausal women. And interestingly, and honestly pretty reassuringly, the symptoms usually just resolve after menopause once those estrogen levels drop. But here's a totally fascinating medical mystery for you. Lots of women in their reproductive years have these varicose veins in their pelvis, but they don't all experience symptoms. Why some women develop this really debilitating pain while others feel absolutely nothing? Honestly, it remains a complete unknown to doctors. It's wild.
Section 3, Recognizing the Key Symptoms. What does it actually feel like? So, the timing of the pain is an absolute hallmark of this condition. The pain is heavily dependent on gravity. Think about it. If blood is pooling in these widened veins, standing or sitting for long periods forces those veins to work against gravity, right? That causes even more blood to accumulate, and that is exactly why the pain is typically worse at the end of a really long day. On the flip side, when you lie down flat, you just take gravity out of the equation. That allows the blood to flow much more easily out of the pelvis, actively relieving the pain. If your pain follows this kind of daily rhythm, wow, that's a massive clue.
Let's flesh out the rest of the clinical picture here. The pain itself, it's usually this dull ache, but for some people it can actually be a really sharp, throbbing sensation, and it actually tends to occur mostly on just one side. Beyond that daily gravity-related ache we just talked about, symptoms often include pain that gets worse during or after sexual intercourse. You might also just feel a general, almost constant pelvic heaviness or pressure, toss in unusually painful menstrual periods, and sometimes even increased vaginal discharge, and yeah, it's a lot. Seeing all these symptoms laid out really validates the very real, super complex discomfort you might be trying to manage all at the same time.
Moving to Section 4, Diagnosing the Hidden Problem, the Actionable Medical Steps.
All right. Getting a diagnosis is a bit of a step-by-step journey with your doctor. It usually kicks off with Step 1, a basic physical pelvic exam. Here, the doctor is specifically checking to see if your ovaries are tender to the touch. Step 2, an ultrasound. Since we're hunting for hidden varicose veins, an ultrasound can actually often spot them pooling with blood. Now, if that ultrasound isn't totally definitive, we move to Step 3, which is advanced imaging. This could be a CT scan, an MRI, or something called venography. That's basically an X-ray taken after a special contrast dye is injected into a vein in your groin. It literally lights up the pelvic veins so doctors can see them.
Finally, step 4 is a laparoscopy. If your pain is severely bothersome and just won't quit, and all that imaging hasn't given a clear answer, a surgeon can make a tiny incision just below your navel and insert a viewing tube to look directly at those pelvic structures.
But hey, here's a totally vital piece of this diagnostic puzzle. Before zeroing in on pelvic venous disorders, your doctor absolutely has to rule out other issues first. A pelvic exam needs to show that there's no general inflammation or, other obvious abnormalities going on. It's really this very specific combination of no widespread inflammation, distinctly tender ovaries, and that crucial milestone of 6+ months of chronic pain. That's the combo that heavily points your doctor toward this specific diagnosis.
Section 5. Effective treatments and relief. The pathways to relief.
Treatment generally falls into two main buckets. First, we've got conservative measures. These are things you can do pretty easily. We're talking standard non-steroidal anti-inflammatory drugs, NSAIDs, just to help take the edge off the pain, alongside wearing compression shorts. Then, if those conservative measures just aren't cutting it, we have minimally invasive procedures. Specifically, there's this highly targeted technique called catheter embolization that uses tiny little coils or medical glue. Let's break these down just a bit more.
I really want to highlight this surprising and honestly highly specific detail when it comes to conservative care. You might totally assume that because this is a varicose vein issue, you should just use what people with leg varicose veins use, right? Nope. The source material is explicitly clear here. Compression shorts may be helpful, but compression stockings are not. Stockings only squeeze the legs, which does absolutely nothing for blood pooling way up higher in the pelvis. You need compression shorts to provide support exactly where those problematic veins are located.
Now, if the pain is severe and just persistent, your doctor might actually suggest embolization. Let's walk through this minimally invasive procedure together, because I know it sounds pretty intense, but it's actually remarkably precise. First off, an anesthetic is used to completely numb a small area of your thigh. Through a tiny incision right there, the doctor inserts this thin, flexible tube called a catheter into a vein. Using imaging as a guide, they literally thread this catheter all the way up, directly to those convoluted varicose veins in your pelvis. Once it's in exactly the right position, they insert tiny coils or glue-like liquids through the catheter right into those problematic veins. The whole goal? To permanently block the blood flow to those specific widened veins. When the blood can't accumulate there anymore, the pressure drops, and thankfully, the pain usually lessens significantly.
Just to be completely thorough here, I'll briefly mention that there is one final option. In the pretty rare cases where those minimally invasive embolization procedures are unsuccessful, traditional surgery to physically remove the pelvic varicose veins entirely might be considered by your medical team. It's a last resort, for sure, but it does ensure that relief is still possible.
So, I'll leave you with this. Are you ready to advocate for your health? Armed with all the info from today's explainer, you now have the medical vocabulary and really the conceptual understanding to talk to your doctor about uncovering the hidden cause of your chronic pelvic pain. Please don't let your discomfort remain a mystery. Thank you so much for joining me today. If you found this medical breakdown helpful, please make sure to like this explainer, share it with anyone you know who might be suffering in silence, and hit that subscribe button for the MediByte channel so you never miss our focused health explainers. Take care of yourselves and keep asking the right questions.